As I see, I think that you can see the first slide.
Yes.
Can you see it? Okay.
Yes.
Well, as you have seen in the email we sent from TransplantChild, the idea of today's meeting was to present the summary of the results that every healthcare provider, the 18 full members of the network, provide in the last quality and safety survey. As we did in Padua last year in November, we have to forward this information we have gathered from the survey. We have to forward them to the representative of every hospital in order to validate the data. And that's the idea of today's webinar, to give an overall view of the results we have gathered. We will also try to give a glance of what is happening around the ERN monitoring group from the DG Santé. And well, that's the idea. Of course, well, this is the agenda. We will do a brief introduction of the monitoring process. We will just talk about some specific issues that we have put on in TransplantChild. We will talk about the participation of the healthcare providers in the last survey we did. Also, we will talk about the transplants that every hospital has declared, that has sent in the last survey. We will give a brief slide in order to focus on the post-transplantation activities. As you may have probably heard before, this is a goal, aim that we have in the network in order to collect this information that will give us not only a better idea of the care that we are providing to our patients, but also can give us also another number of patients that we can consider give to the European Commission when they ask for our data. We'll also talk about the outcomes of the transplantation. We have some data that our hospitals have sent us through the survey. And finally, we will talk about the data validation process that we are going to do this year. As you know, presential meetings are not possible, so we will do it online. That's the idea of this year. And some next steps that we will take ahead. Well, this is just a slide in order to give an overall view of the ERN monitoring. First, I would like to say the three ideas that you have here in the slide. The first one is that, as you know, we have already 5 years of functioning of the networks. They started in March 2016, and we have done some improvements in collecting our activity and the things that we do, not only when we correlate with each other, as you see in the slide, for example, through the clinical patient management system, but we have also done some efforts in order to keep records of other activities in the research group, in the training group, the surveys that we have mentioned. We have done twice, I mean, two of them, one in 2018 and one in 2019. But we have to keep in mind that the main core of the networks, the idea that the European Commission has, is that we have to focus on the patients that are referred to all the healthcare providers participating in their ERN. That's the bigger picture. That's the aim that the European Commission wants us to focus. So last Thursday, we participated in a meeting of the ERN monitoring working group, and they told us that in this point of the year, this issue is going to be very important, that we are able to show what is our performance, what is our activity, and what is the number of patients that we attend in every hospital, specifically in our case in the transplantation in children. because that effort will influence in the current Commission proposal for the new budget. The new budget that the European Commission is preparing, as you can see, it's from 2021 to 2027. And ERNs are now in a very good position, but we have to give with our activity, with the monitoring of the activity that we push forward in every network, we have to give the European Commission more arguments, more input, so they can get a better position in that future European long-term budget. As you may remember, of course, a lot of things has happened after that, but we launched the last quality and safety survey February the 13th. In that, as we did in the previous year, we sent the survey to all the healthcare provider representatives in the TransplantChild. We focus again in the full members, but we know that we have already affiliated partners and new members in the process of getting into the network. But well, that was the focus of last year's quality and safety survey. The deadline for including the transplantation activity was opened by the European Commission platform until the 3rd of April, and we reported finally 649 transplantations performed by all our 18 hospitals in 2019. If we have here the number, we said we have done the year before, 663, but well, the important thing, we will focus now afterwards about the specific number of every center, but well, as I mentioned before, we have now to not only to share the results that we are doing it in this afternoon's webinar, but also we have to get them validated by all the participating healthcare providers. This is an overall slide where we have the picture of how many of our hospitals participated in providing data. As you see, only 13 provided data when we ask about the activity we do with the patients when we evaluate them for transplantation and we care for them in the waiting list. 17 of them, one of them was missing, you will see them in the next slide, give us the number of transplants performed in 2019. 14 of them provided data about the outpatient follow-up and care, and 13 provided data about patient and graft survival. As you see, our healthcare providers, as happened before in Padua when we talk about the activity of 2018, we have put forward that it's very important to collect the transplants that we do every year, but we have to keep putting into importance that if we want to get the overall picture, and we have to have a stronger point of the role of our network comparing to the other networks in the overall position of the GD Santé, we have to try to keep all the data and provide them not only about what happened when we do the surgery and transplantation care, but also before and after. Well, this is one of the first slides that, well, this is the slide that shows us what the data we have received from our 18 healthcare providers, full members, activity of transplantation in 2019. Well, it's you have the 18 centers in the list. The person, the representative that reported the information, as I mentioned, we use the survey that we presented before. You can see in the slide by every kind of transplantation, liver, kidney, intestinal, multi-organ, lung, heart, and hematopoietic stem cell, you have the number we have received, and in the cells that we have an M, we have that information missing. In that case, as you can see, there's a hospital that we didn't get information at all last year in the survey. We will put them this slide so they can add now the missing data. But I also want to focus on the data that you can see that are not reported. This is an issue that we have discussed before in the network, but we have some transplantation programs in some of our centers that we are not able to collect the data and to share it through the survey and to the network. So we have to focus again that perhaps, I mean, this is a work that has to be done at local level, but maybe those centers that are not able to collect that data can contact the coordinating center, and we can try to solve it. But it's a pity that we have detected that these centers have this transplantation activity and that we are not able to collect it. So you can see here, as I mentioned, this overall picture, and as we will talk about that afterwards, this information is the one that we will send to a representative to validate. The following slide is centered it's about the reported outpatient activity that we have received through the survey. It has the same format as the one before. In this case, you can see that we have much more missing information. I mean, this is transplantation programs where we have the number of the surgeries, of the transplants that we have made, but we don't have the number of patients, of individual patients that we are following in outpatient care after transplantation in last year. And it's something that, again, we think that it's very important and that gives quality to the work that we are doing in TransplantChild. As you can see, this was the first year that we asked about this and we are sharing it. And we have some centers that didn't provide it. And again, some centers that are not reporting some transplantation activity that we believe they have, but they are not doing it. And finally, you can also see that in this case, some figures might look perhaps a little too big. And I want to say that this is something that we have to validate with every center, because in this case, what we wanted to have is just not the number of visits that we may have done during the year 2019, but the number of individual patients that we have been attending during the year. So in some cases, the number we have received is not exactly what we asked for, and that's something that we will also try to validate with all the hospital representatives, because in some cases that number is not real.
Jose,
yes.
Did you ask for patients that were followed at this time, or I mean, because some of the patients has grown and become adults, but they are not included here, or how was it?
Well, we asked about. I mean, I have to look for the definition, but it was about getting the number of patient children that are being followed in outpatient care in the same hospital and during the period. So maybe, I mean, I think because we in the survey we ask for the number of patients, individual patients, and we also ask about the total number of visits. So maybe in some cases we got the visits instead of the patients. And that may explain some big numbers that we see in this slide. But the idea was to get those patients that are still being followed up in our outpatient care, and that has not been transferred to adult setting or to other hospitals. No, that's the idea. I mean, it was the first time that we asked in this way. And as I mentioned, probably some figures just have to be corrected by our healthcare providers, and after this time we will have a better picture. In fact, the idea should be probably that the number. I mean, although maybe in some cases we do the transplant and we don't do the follow-up in our hospital, usually the number of patients that we would have in the outpatient care should be bigger than the number of transplants that we have done this year, that year. So that's the general idea. But as I mentioned, we have to figure that out with every center. But well, that's the overall picture, and that's the idea about working that and getting it better in order to have the real number. Well, the other two slides we will present is about patient survival. Again, we have, as I mentioned before, most of the healthcare providers have given us specific survival rates, and as you can see, there's a big gap in some of them, and that's something that needs a further analysis, because in some cases there will be differences that will be real, and in some cases there will be not. But that's something that we haven't studied. This is the overall picture, as you can see, for every type of transplant in 1, 3, 5, 10 years, the patient survival that we have received from our healthcare providers comes to that percentage. And when we talk about graft survival, again, there's also big differences that we will have to study in detail, because we cannot come to a conclusion only looking at the range of percentage or the range of survival that we have, that the centers have reported to us. Just 2 slides more, and then we can discuss it among us. Any slide you want. The following steps will be to send these results to every healthcare provider representative, because we need a formal validation in order to consolidate the data, as we did in Padua. Remember that in Padua we showed the data, and afterwards we send an email, and every healthcare provider validated it. This is a chance to complete missing and not reported data. Remember that we asked for this data in March and in April, and in some cases perhaps was not the best time of the year according to what was happening to get the data. So some healthcare providers will complete the data now. Just to tell you also, they announced us last Thursday that they will collect the first semester ERN activity next month in October, and we will think about asking also in that email where we ask for the validation to get some additional data about the activity that we may have done in this first semester of 2020. And of course, we have to start to think about a new quality and safety survey. We have to design it by the end of the year in order to collect the activity results of this 2020 year, the transplantations and all the activity before and after transplantation. We have not discussed if the survey will be similar or not, but well, that's an issue that we will talk about later. Just for highlights, the first one is that as the DG Santé announced us last Thursday, we have to focus now more than ever in the data monitoring and the performance of our networks, because this is the key for the future funding and sustainability of the networks. In some way, the data will become public. The European Commission has announced us that they will publish the overall activity of the networks, and we have to also discuss if we want that to happen with our data. And in somehow, the way that we are perceived will change, will be based on the results we publish and not in the narrative anymore. As I mentioned, DG Santé is especially interested in the numbers of patients referred to all the hospitals participating in the networks. In our case, that may imply, as we mentioned before, to get not only the transplants that we perform every year, but the number of patients we follow up. And well, this is finally an issue that we have to look at local level, because as we mentioned before, some centers did not provide the requested information. Perhaps we didn't explain it as good as we should have, and that's something that we have to solve in the near future. But in some cases, maybe some things have to be done differently at local level in order to retrieve all the activity results that we want to gather together. That's all. I don't know if you want to add something else, because I have talked too much.
Thank you, José, for a nice presentation and nice work collecting all this data. I think it's important to validate it, of course, as you say. About the missing data and the centers that have not sort of responded, is that no response at all, or is it just that they have not reported the data? Sort of, do you have contact with them so you know that they are still in business?
Yes, we have contact with them. In fact, as you may know, we ask from you some data about an article that we have been working on about the issues of transplantation in the COVID-19 times. And yes, I think that all centers are connected, but perhaps when we do the survey exercise, perhaps it was not the best of the times when we did it. In February, March, and April, and we have now a chance to complete the data, or the missing data that we didn't gather. But perhaps we have also to think. We have to think again in the next survey if we have to give extra clarification or information about how to fill up the survey, because maybe we are not giving enough clues, in order to help people filling it up.
Well, it's always difficult to get people to respond and fill in data. Of course, there are always somebody missing, but it's a little strange that, because these data should be known to them because they have filled them in for the original application, so I guess they have them. Mm-hmm. It's difficult to understand, I think. What about the affiliated members and new members? Will they be included in the next survey?
They have asked us about getting some affiliated partners data. I mean, we will have the chance for the next survey to think about what kind of information we can ask the affiliated partners. So that's some issue that will be new. But
I guess yes, it would be good to include them.
Of course. And about the new full members that are now currently in the process of evaluation, we have to wait. I mean, the process has not finished, and probably they will not be formally inside the network until next year. But anyway, you have mentioned it, and that's right. We have some information that the new members have provided through the affiliated form. I mean, the application forms. So we can be able to put them together also in the group because they have already put it when they did the application form. So it's something that we can use also.
Well, that's it. And I think also, as you mentioned, we could clarify some of the questions a little bit more, so it's easier for them. But.
You know, if you have any more questions. As I mentioned before, we will send these data to all the healthcare providers' representatives. So please, if it's not yourself, tell them that they will be asked to validate this data. And as we mentioned before, the data we are gathering is every time more important. So we have to also focus on that. If we do a good work about collecting this information and sharing it among us, then they can use it. And when I talk about they, it's the European Commission. They can use it in order to get more funding, to this network. So that's also an idea that we wanted to remark.
Could I ask one thing about your table? There were some columns there and boxes that were marked with not reported, I guess, NR.
Yes.
For example, for Karolinska, we are, in the original application, we applied to join for kidney and liver.
I'm going for it. Yeah.
And here it says also not reported for hematopoietic stem cells. And is this why is this? Is this an option for us to report? Because this is done also here. So, but we are not. That was not in the original application. We did not apply for that. But do you put these figures anyway, or?
Yes, we just what it means there in not reported means that when we did the transplantation map, the European transplantation map, we detected that your hospital did that kind of transplantation type, and that is why it's there not reported. Okay. I mean, it doesn't mean that you have to report it, but that you may report it. And we think that it's important that if in your center you have that kind of transplantation program, you may put it into the application form, because I think that will help all the network to put. But that's optional. Yes, but we will. It's optional, but we suggest it or we recommend it very strongly.
Okay, I will do that.
I'm going again back to the message to the Pajón. I know somebody else joined to the meeting. I don't know if the ones that you have joined to the meeting want to add something.
I'm sorry, José Jonay. Hello. Yeah. Sorry to interrupt. It's only regarding what Lars was saying before about different programs that were not applied at the beginning in the application form, but it's okay to include them, all the ones that are working on your center. We mentioned that to the European Commission, and they said that it was okay if some hospitals that belong to the network have another programs, and they wanted to add them to the activity of the ERN. So it's all right, and you are welcome to add all the programs.
That's very good.
Sorry.
Thank you, Marisa.
That's good.
I don't know if there's no more questions. Again, I would like to thank you all for joining the webinar, and it's very good to see you, especially in these times. And we look forward to seeing you again soon. Thank you very much.
Good afternoon. Goodbye. Have a nice day.
Bye. Bye.
Bye-bye.